All right. So welcome everybody. Why don't we go ahead and get started? There may be a few other people joining us, but I want to make sure that we have enough time to do what we need to do. My name is Wendy Madagoski, and I'm the director of the IPED course. And so I'm very delighted that you're going to be joining us this fall and participating. This is the training for people that have not been a part of the interprofessional education programming before, and in particular around IPED. And we're going to go over several things to orient you. I'm using the mic because we're recording the session, and that's why we have you in these places as well, so that when there's a couple of folks that are going to need to miss, or if we have other people join us later, they'll be able to watch this and have it make a little bit more sense in terms of the workings of TBL. So let me just share with you what our agenda is. We're going to spend just a little bit of time in some further introductions, and then I'll go over some of the goals that we have for today. We're going to focus most of our time on the basic roles that we have as faculty, a part of the interprofessional education program, and that has to do with understanding what IPE is and what we do here on campus, as well as team-based learning in particular, and then our coaching frame that we have to working with teams of students. So that's going to be most of it. As part of that, we're going to actually be a little bit interactive and go through what some of the team-based learning activities are like, so that you are familiar with it before you pop into having to help orchestrate it. So that's what we'll do today. And really this is the time to ask questions about what seems unclear to you. We have very complex processes because it's taking a lot of, I think, important things to scale with a large number of students. And so it can be confusing. And so this is the time that we want to make sure to give you the basics and the background, but also give you an opportunity to ask questions. So please don't hesitate to interrupt me at any point and ask, okay? All right. So with that being said, let's do introductions a bit more. So something that'd be good to hear from each of you about is not just your name and what professional background you have, but really what and where you work, but also what really drew you to doing some teaching in interprofessional education. Something that that I've been continually impressed with is the reasons and the diversity of the faculty that we have that are a part of IPE. And learning about that, I think, helps to encourage us to get to know each other and to enjoy what we're doing together. So just a couple of minutes for each of you on these topics, in particular about IPE, as well as if you have any experience in teaching interprofessional students or in the content areas that we have for the course. So all of that is up for grabs. Does that sound good? All right. Sarah, do you mind starting? Welcome, Jennifer. Scott. And 11, yeah. That's good. Yes, thank you. Pardon for the interruption. I'm having my morning clinic still following me. So, welcome.
I'm Reese Rowland. I am the sure what's happening. Feel free to email me directly.
And I'll just say, if my voice is ready, a little bit about my background. I'm in family medicine, and I've recently been sick, as you can tell. And I work at AF Williams, so Sarah and I get a chance to pass each other in the halls more than actually collaborate too much yet. But and I've been involved in in IPE since 2014 formally through our current rendition, but also was a participant in our prior course, which was the Ethics in Health Professions course. And I'll explain a little bit more about that, our history here. And really have just, but I think was drawn to some of this work because not only is it a part of what I do in primary care, but I also remember very much enjoying learning about different health professions as a student. Where I went to medical school, we had PAs that were a part of our classes. We were sort of intermixed with a lot of different professions in our early clinical experiences. And I always remember very distinctly figuring out on my first day of third year that if I actually really wanted to know anything about what was going on with my patient, I needed to connect with the nurses and figure things out. And so it was very much a sort of practical, but also clear interest for me based on my prior training to want to be a part of this moving forward. So it's been quite a journey and we've done a lot. So let me share a bit about that. So I think I referred to this a little bit, that partly what we want to do is get to know each other and then develop knowledge and skills in our 3 faculty roles. They're IPE promoter, TBL facilitator, and then team coach. And there's different skills in each of these. And one of the things that we'll do today is introduce you to them. And we've kind of evolved our understanding of this over some time. And it could be that for some of you, the content or the process of one or many of these is going to be more interesting. Frankly, when people first start the TBL part, if it's new to them, that takes a lot of sort of mental energy to get familiar with. And so that, that's what they sort of lead with in terms of learning as faculty. But over time, people kind of pull in some of these other aspects too. So I mentioned this not to be overwhelming, that there's a lot going on, but to really say there's just this great diversity of things that we're doing with our student teams. And so there's a lot for you all to hopefully gain in your own professional development around participating. So we're going to spend just a couple minutes on basics of interprofessional education. So interprofessional education has been going on for a very long time, and there's been different pieces over the years that sort of come out through formal education. Like in the 1970s, there was a lot more about team care and working across different professions, not just within the health professions, but in other disciplines of study. But it really was in the late 1990s that there's been a resurgence for the health professions. And this came about in part because of influential reports from the Institute of Medicine, which is now has a different title. But these really made a stir. The first one was that it kind of brought up the point that we make a lot of mistakes in healthcare and that patients are harmed because of this. And that first report really just put that data out there in a way that was paid attention to, and it had not been previously. A follow-up report said, well, how are we going to fix this? Well, we're going to actually make use of health professions and training and change what we do in terms of how we train health professions. And that can be what we can use to get to better quality of care. So from this beginnings, there became a sense that we needed to focus in on health professions education and to bring people together in ways that we hadn't previously. So the WHO, or World Health Organization, made an addition to this sort of national, international effort to bring attention to IPE by defining what IPE actually is. And so they define it as when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. I think this definition is brilliant still. The idea that we really want students to be learning not just with each other, but about each other, and not just about each other, but from each other as well. Each of those different verbs makes has a different connotation in terms of what we actually do. And it can't just be for their own purposes. It really needs to be for the purpose of enabling improved health outcomes and doing that through a vehicle of better collaboration. So that means that we want them through interprofessional education to then come out of our schools with better competence in collaborative practice. and that they can do this to help move the health system forward. I have a colleague who talked about, if I can get the pithy phrase, nope, it's not coming. It might come later, but essentially it's that you have to like you have to train the young, educate the young, regulate the old. That's what it is. So that some of us who are already in practice need to be perhaps pushed into these new ways of collaborative practice, but we can educate the young and that be the new norm moving forward. Now, the good news is that this is not just these sort of white papers that people have written and pushed out there that the public has noticed. We also have some teeth in the game here with accreditation agencies for each of these different professions listed, saying interprofessional education is important. So there are standards, meaning you can't be accredited, i.e. you can't really be a school that has students coming and graduating from them without meeting some standards around interprofessional education. So that's part of the great news. And there was a fair amount of momentum happening before this, but some pretty crafty sort of negotiated work to get this done. And they said, here's what we think competencies are, and we're going to make sure they become part of our accreditation standards. So it was a good effort, and that means that the schools need to be a part of it. So what have we done here? So I mentioned that we've had a prior course called Ethics in Health Professions, and that started in 1998. So even before this sort of new wave of information around interprofessional education. And it came because of a mandate from the vice chancellor at that time, a couple years prior. So in 1996, he said, okay, all of you that are here on this campus, you have to get together and you have to teach your students together. It just makes sense. Pick something, do it in a year. Woo, can you imagine giving a one-year mandate to sort of reorganize everything? Well, they did the hard work and they got it done. And they selected Wednesday afternoons as the time when they would pull the students together and teach ethics. Now, the good news is that they had taught ethics in each of the different courses. They, were able to figure out different programs. They figured out that this was a common area, and so they brought the students together around that. And that was a very successful course, and it went up until 2013, and only stopped because we evolved on campus as to what we were doing on interprofessional education. But we're very lucky to have this history here, and not many institutions have that background. The other thing is that many of the people involved in that course were part of planning this new campus. And so they had the vision way back then to actually plan a campus that did not have necessarily all the named schools in different locations, but that they would have shared educational space, shared collaborative, we're not necessarily always collaborative, but shared co-located space for administrative work. And so that's, our education building structure here. Now, there are a couple of exceptions. We have a school of pharmacy because there was some nice funding for that at the prior location, and then we moved. Oh, that was so sad. They just built that building. And anyway, and the School of Dental Medicine has their own space. But other than that, it's, we share this space. So that's pretty unique. Now, form does not always drive function. And you need to have processes to help enact it. So there's several different things that helped us move along. The first is that we had some decision about having a campus-wide director of interprofessional education and having some funding related to that. And then we got a wonderful grant from the Macy Foundation to start up doing additional work, and then had several different renditions of trying out how do we bring students together for collaborative practice, because we already had them together around the ethics content, but not about some of the teaming skills. So several different renditions of that, and with some reorganization towards the end of the grant funding time. And then, and we are in our current rendition that has been in place since 2014, which is sort of that IPED classroom-based structure. And then in 2017, we rebranded ourselves as a Center for Interprofessional Practice and Education, with an emphasis, including an emphasis on the practice of health professions and not just the educational pieces. So I'm going to stop there just for a second. Any questions about this background? Okay. So our vision of the center is to transform health professionals and healthcare through nationally and internationally recognized interprofessional education and practice. And so we want to, as our mission then, is to actually spend the time preparing those professionals for that practice and do it in innovative ways. So we have all these programs involved on campus: anesthesiologist assistant, CHAPA, which is the Child Health Associate Physician Assistant Program, dentistry, medicine, nursing, pharmacy, physical therapy. Public health is also electively participating currently. But they also have a new accreditation standard about needing to do IPE, so we'll see how we further engage them in the future, which will be terrific. And then this is the sort of new version of our schematic of what happens from a student's perspective when they are a part of interprofessional activities on campus. So they start off with, in their first year, something that's called the Open Campus Program, and they get involved in various activities that help them learn about different roles and responsibilities and do things together with others on campus. Then they enter into the Interprofessional Education Development course. And then after that time frame, most students will then also be a part of some simulation, which we call interprofessional clinical transformations. And then finally, we continue to aspire to have more opportunities for our learners to engage in the clinical setting together. Usually, each of the programs has, they last different number of years, so it may not be the same students that they were in the IPED course that they're doing work clinically together, but they would engage with others interprofessionally, clinically as well, to make that an authentic experience. So that's the general framework. I think I just described all of this. So this is the Open Campus Program. Just something for you to know is that this is going to be going on this fall. So if you see some things about IOCP, we're trying to get people to get used to all these acronyms. Please feel free to join us. Each of the schools is sponsoring some programming, and then other community partners are doing things. So it's fun. And as part of this, we have a One Book, One Campus initiative where everyone's reading a book together. So some fun things like that. IPED I'll go over in more specificity a little bit later, but essentially this is 2-semester course. It starts in the spring, so it goes by the calendar year, which is a little odd, but we're used to academic years starting fall and then spring. But we start in the spring of the first year because that gives them a little bit of time to get their feet wet in their profession, and then end in the fall of their second year before they get too busy with going off into clinicals. And then we have 3 content domains: teamwork and collaboration, the ethics and values, and then safety and quality. And new this year, we reorganized things so that the spring semester primarily focused on ethics and values, and this fall semester that you all will be joining into is primarily focusing on quality and safety, as Tammy was mentioning that. Yeah. All right. Here are our course outcomes. So we want students to develop basic knowledge, skills, and abilities in those 3 content domains. But we also want them to understand what it's like to be a part of the profession of the general health professions. And so not just their own profession, but also what is it like to start to developing a professional identity around being a interprofessional care provider. We also want them to learn about each other's roles and responsibilities as best we can in this early time for them. And then most importantly, demonstrate some of these skills: collaboration and teaming within their interprofessional team. Clinical transformations, this is the simulation activity that I was mentioning. It's a one-time deal. They get together with different teams than their IPED teams, and they have a couple different scenarios where they have to engage and practice and demonstrate their skills. The scenarios are across the different settings, and they kind of depend upon the student team. So say for a particular afternoon, we've got some teams of PT students and nursing students and MD students, and there's going to be a particular case that will fit well with that cohort. And another afternoon, it might be dental and pharmacy and nursing, and then so there's a different case for that cohort. But the students really enjoy this. It's a way where they're actually putting some of the skills that they learned in the classroom into a simulated environment. And if we had unlimited funds, we would do a lot more of this because it's a lot of fun for them, and there's some really good learning in their teams. It also is nice because it gives them a chance to try to do the sort of quick teaming experience. In the IPED course, they get to be on the same team for 2 semesters. So that's a different type of teaming. Like you develop, familiarity with people over time. But sometimes you need to come quick together and be a good team member. And so that's a bit what this is prompting them to do as well. So some differences. And then the final section is this clinical practicum. And this is something that, again, is still in development. I'm showing a picture here of the Dawn Clinic. That's where a lot of our students come together and do interprofessional care together voluntarily at a free clinic that was developed by students. But there's many different settings where students will work with other professions. And we're continuing to evolve those and develop them and think about common assessments. So even though we're 4 years in, we're still working quite a bit on getting some of those more challenging clinical-based experiences for our learners. Okay, so let's see. You met Reese. I just wanted to mention that there's also Michelle Colarelli. So she is our curriculum manager, instruction designer, faculty member, and so she helps to put a lot of the content onto Canvas, which is our learning platform that we use both for faculty and for students. And so you will probably get familiar with her as well. If you haven't already, I would encourage you to watch the video that was sent in the link. We think it's a pretty good summary. I know it kind of covered some of those things again, but part of the reason to go over it is that we want you to know it well enough so that when the students ask you, or when your colleagues say, well, what are you doing this semester? And you say, well, I'm teaching in this IPE thing, that you're able to define and explain what really we're about. Okay, now we're going to transition to BL. So how many of you have had any opportunity to be a part of team-based learning structures previously? Scott has. Tammy? Okay. Okay. All right, terrific. And I hope that the materials that we provided you, the little video and the kind of 2-pager thing, was a reasonable introduction. We do some things slightly different than what you would have seen in those, like in the paper document, for example. But for the most part, it is the same. So one of the things that we wanted to spend time on today is really familiarizing you with this so you don't feel lost when you join us in the course. So just to start, I want to kind of talk about what's in the room here with us. So you can see that there's a stand that has a floppy number on it. Sorry. And we have students are assigned to interprofessional teams, and there's generally teams of 6 to 8 students. We have more dental, pharmacy, nursing, and medical students than we do of the other health professions. So every team is for sure going to have one of those, but maybe 2 in some of the teams. And then I think all teams are going to have dental. Next year not, but close. Close. Oh, no, wait, when I'm saying dental. Who? Okay. And then in terms of PT, there'll be fewer PT students, fewer physician assistant students, and then the fewest is the anesthesiologist assistants. There's only 12 of them, so they're only going to be in 12 of our. We run 23 rooms at one time, so you're not going to necessarily have one in the rooms that you're in. So the students gather around in their teams and are assigned to teams, and they stick with that same team for the whole course. And in fact, we orient them to that team during the IPE day, orientation day, which is happening in a couple weeks if you guys are participating in that as well. So they start with that day and that one day in the fall, and then they come back into the spring and go back to their same team. So teams have numbers, and in the rooms, and I'll hand this out here, they all wear lanyards that are colored. And here's sort of your cheat sheet for the colors. We don't have the lanyards in here for you to see, but this is the way you'll be able to, quick at a glance, be able to see the distribution of professions within the teams that you're working with. Now we also have something else that we call team color groupings. And so this has nothing to do with the students' professions. It has to do with how we're organizing them for our faculty purposes. So we have teams 1 through 21, for example, that are red, and their folders are red as well. Is that correct? Okay. So you're not seeing that right now. This is team 6, and it has it's blue. But anyway, but part of the reason for doing that is it helps us with our organization as we every session put out the materials and put them back and clean them up and get the new things packed. But newly this past year, there also are ways of grouping our faculty. We've kind of discovered that it's such a big course, and you want to get to know your room, obviously, but you also want to have a chance to, brainstorm about how to improve things with other faculty. And so we have all the faculty that are working with the red teams to get together. Okay, so when we have our briefs and debriefs, we have them in different sections. So all the red team faculty will be here, and yellow and blue and green, purple. So that way we enable you all to get to know a couple other faculty and start to develop a little bit of a support group for each other as you're working through your development as faculty. Okay, so so other than the team sign, we use this often in the sessions for like when the teams are done with an activity, they'll put the sign down and things like that. You also have a team kit. And so faculty will have their own team kit, and I've got some example for myself as a facilitator today. But this is what the teams will have. I just wanted you guys to get a chance to see what it was like. So they have a whiteboard in there because we use this for team report outs and some markers, whiteboard markers, and a little whiteboard marker wiper offer. And then they have a folder with materials for the day. And always in the folders, there's going to be a sign-in sheet that the teams will fill out. And the teams that you're going to be joining this fall are used to doing this. So I guess they might need a reminder as they're coming back after summer, but they always sign in. And then we have some extra materials in here. We have Scantron sheets if we need them. And then these little things are tent cards. And in some rooms, the faculty really like having the students use the tent cards because they can see the colors of the lanyards, but they can't really see the students' names. And so if you want to get more familiar with individual students' names, then you could use that. And they also have extra little pencils on here. Please note there's no eraser on here. So when the students do their Scantrons, they have to be very careful or have to be sharing of erasers with each other. But that's pretty much it. And what would be in here otherwise, and you don't have examples of this today, but in the team kit folder for the students, is if there's handouts or other materials that will be in there. A couple things that we have sort of instituted over time, include a document where the teams track who's having what role on their team for that day. For example, there's one team, or there's one role where they're the person that's making sure they're doing the briefs and the debriefs. Another role where they're scratching off the rat card. That's the rat scratcher role. There's other roles that they alternate amongst each other, and they keep track of that on a salmon colored sheet. We have also asked the teams to develop ground rules. And so there's a ground rule sheet that they have that stays in their folder. So there's a couple things that are sort of enduring reminders of good team behaviors that are a part of the folders. And then if there's additional handouts or case descriptions or things like that for the day, those will go in there too. Okay, that's materials. And one thing we ask you to do, because there's a lot of work to kind of get everything ready, is that when you come to our briefs and you pick up your bag that has all the team kits in there, we just want to make sure that you get familiar with everything that's in there. So our first 10 minutes of our brief are for people to come in, take a look at the bags, make sure everything looks good. Are they completely missing their sign? Sometimes their things get missed, and so that's our chance to fix it before you're in there and then struggling on your own. So so that's partly what we do. And so I wanted to emphasize that in part because when you're teaching, you want to make sure that you know what materials you have to use. Sense? Yep. So they're going to be prepared, and we have these big bags from TJ Maxx. Is that what they're still? That's right. That will hold hold your facilitator information, and then also hold one team kit for every team that you're with. And in any room, there's 4 or 5 teams. Other questions on that? Okay. So let's move on then and actually go through the RAT process. So you should have picked up a document here, that says RAT process. And again, there's like all these details on here, but this is because we've figured out that in order to be efficient, this is a great process. And in order to be fair in all of our rooms and have similar experiences for all of our rooms, that we should follow this process. So I would encourage you, as you're starting out, to think about actually having this document available and use it as a checklist for you. Now, if you're going to be working with somebody else who's experienced, by the way, that's just, you should know that. And it could be that maybe the first time you're kind of just sort of letting them lead and you're kind of mentally understanding the flow here, okay? So the students, it's nice to know the students are familiar with this already. So you also see it work well. But it's important for you to get familiar with it, because when we move on to the spring or the IPE day, the students are going to be like, what's going on? And so you have to know the flow well enough to be able to help guide them to get it to be efficient on it. So I'm going to kind of talk through this and show you what it's like. And we're going to actually do a little RAT process with us here. And we'll have 2 different teams here. How's that? Okay. All right. So let's see. Scantrons? Can't remember. Okay. Yeah. Okay. So we typically use Scantrons for the students, but you don't have to do that for today. But there's some very important things that we tell the students around the Scantrons, is that they have to include their name and their student ID number. And it also helps if they put something like the date on it. We've never had an incident where we've had 700 Scantrons and we've dropped them, but it could happen, and so it's just good to have appropriate identifying information. It is exceedingly interesting to me that every semester there are still some students that use pen on Scantrons or don't fill in the bubbles. Like, we've been doing this for a very, very long time, but it still happens. So part of what we ask for faculty to do is to remind them of those very basic things when they start. Again, these students should be good in the fall, but I'm mentioning this just because it does happen. And then, Reese has a big job of trying to figure out, with Scantron goes through, but it's missing, and it's wrong, and we got to match it up with the student. And anyway, it's a big mess. Okay, so we have the process where there's the individual RAT, and so for this fall, we're going to continue to do all this on paper. And so there's the green RAT sheet that you would distribute as a faculty member. And so I'm going to kind of say, all right, here are teams, here's your RATs. Please hand them out to each other. Don't start until it's time for everybody to go. So hold off on taking a look yet, please. Make sure to put your student ID on your Scantron. All right. And then what we do is we actually time the taking of the RATs. I'm going to use my phone for right now, but typically what we would do is actually use a Google countdown timer that we project up, and so that everyone can see it. So we're going to do 5 minutes for this RAT. And so when I tell you, go ahead and take the RAT individually. You can circle your answers on this. If you're done ahead of time, please look up so that I can know we can move on. Okay? Go ahead. have 2 minutes remaining. So this is something that you would do as a facilitator, is announce when there's 2 minutes left. Okay, so we're going to stop, but I will tell you that in the actual sessions, you do need to give the full amount of time. And this is because we have students that have varying test taking language abilities, and so it needs to be fair across all of them because it is for a grade. If students have accommodations and they need double the time for testing, we handle that on the central side, so you would never need to worry about that in your classroom. So students request accommodations, they actually take the RATs earlier in the accommodations office center, and then they typically, what the students have done is they choose to still come and sort of do a fake one in the classroom setting, or they might feel comfortable with saying, hey, I'm just going to show up, you know, a little bit later, but that's sort of they might miss some introductions or other things like that. So for the most part, students still come, but that way they get their accommodations met. So Tammy. That's right. So just like you, they get pre-work posted a week in advance, and then they have the time to read that, and then they take the quiz in the classroom. Yep. Any other questions so far? Okay. All right. So now what we're going to do is do the TRAT, and typically what would happen at this point is that I would come by and collect all the green sheets and all the Scantrons as a faculty member, and then my co-facilitator and I, when the students are doing the team-based RATs, we'd actually just quickly sort through them and try to find anyone's with a pen or not missing a student ID. It just helps us so much. I know I'm emphasizing this, but with that many students, yeah. But for right now, I'll have you just hold on to that, not look at it, but hold on to it while you do the TRAT. And so for the TRAT, what we do is there's blue sheets. And for each team, we give 2, which for right now will make it pretty easy because there's not that many of you all. But we give 2 just to be able to provide enough, you know, with up to a team of 8, sometimes it's hard for everyone to hear, and some people are more visual and need to see it. But we don't provide one for every learner because we want them to huddle around the test and to work together on it. And that works really well. And I feel like that's something that is probably one of the better moments of the TBL portion of what we do, is that like it really helps to pull the team together when they have to work collaboratively on a quiz. And then you do the scratch off cards, which is a lot of fun too. So let me share one of these with each of you, each of your teams as well. And this is also a fun part. You need either a back of a pen or a coin or something like that to be able to scratch things off. And we want, what we, particularly as we're instructing teams, we want them to put their team number on the scratch off card. They need to know that if they scratch off the correct answer, they'll see a little star underneath it. If there's no little star, then they get to scratch off again and again and again until they get the correct answer. But the number of times that they have to scratch, if there's higher numbers of scratches, then that's fewer points that their team gets. Okay. And I think on the top of the blue sheet, it actually talks about what this rating scoring is for that. So you want to get it correct. Now there's, this little star that's underneath that you scratch off moves. So you can't like cheat and just sort of scratch the right upper corner and see if the star is there or not. So it moves within the confines of the scratchable area. And oh, I dropped my coin down the middle of all of them, right? So And these are all coded to match up with what the quiz is, okay? Um, just as a quick tip, the code relates to what the form number is. We do not tell the students this. The students don't care enough to like keep track of what the form number is or anything like that. But if you ever see people like, I don't know, or if they have questions about it, that just to know that's like we know that says D, form number D011. We know what the pattern is underneath that. And then we match that up with our test, okay? And there's another card that has a different pattern. So every session we have a different pattern, okay? Does that make sense? How that works? Okay. So for the T-RATs, for the I-RATs, generally we do 10 minutes or 7 minutes. And for the T-RATs, we do 10 minutes. For the purposes of today, we just did 5 minutes of for the first part, and we'll do 8 minutes, but I don't know that you'll need it for the T-RAT. But I want you to go ahead and talk amongst yourselves and go ahead with this T-RAT now and try the scratch-off cards, and then we'll go and have a discussion. Yep. You want to go ahead and put your team number on here and then go ahead and score it, which is pretty easy to fact, but just to 5. Mm.
Go up here.
Mm-hmm. We do. Oh yeah, no, that normally that's not on there. That's just for our reference for today.
Reese Spencer Thursdays.
Test. Yeah, that's you don't have to worry about that. So you could put like maybe your team number 7. Yeah.
They go to the scan.
Yep. Go ahead. Mm-hmm. But you'll see the students do as well.
Which column do we?
Doesn't matter.
It doesn't matter. Okay.
Yeah.
So a 5 for each one.
Correct, because you got them. And total would be 25, and test or your team number. Okay, so kind of simple there. And then what Scott's doing is, what we have the teams do in terms of the report out is use their whiteboard for this. Before I go on to this, I just want to say we ask teams to put their team times down when they're done so that we can get a glance at the room, because unlike the IRAT where you do need to spend all the time so everyone has the same fairness for their individual quiz, for this, as everybody's done fast, you can move on. Okay. So you don't have to wait till the 10 minutes finishes for the TRAT. Does that make sense? Mm-hmm. Okay, so then what we do, yes. Yep, on the TRAT. Yep. And that's why it usually takes a little longer than what you guys took, because hopefully there's some disagreement, and there's and the whole point of the TRAT is that if you have that conversation, you're more likely to get to more correct answers as a team than you would as all your individuals would. And so there should be learning amongst the students. Now the reality is sometimes the students will say, well, I just remember seeing that in the reading and I'm confident about it, and they'll go with it. Or let's do a vote. Or, so those are okay ways of coming up with team reasonings, but it would be better if they're saying, well, I really understood the concept to be X, Y, Z, and it fits into my worldview because of this and that. And the pre-work sort of suggested that, so that would be like, the most mature conversation. But sometimes they're like, let's vote, so but one thing that we do, which you probably saw on here too, is that we reorder the answers. So if you look at your answers, the questions 1 through 5 are still in the same order, but the order of the responses are different. And that way they can't say, well, it was A, B, C, F, is that what you guys got? And skip actually talking about it. So we spend this time, reorganizing it so that they have to talk through the actual content. There definitely are teams that have challenges around those processes, but we tend to not intervene as TBL facilitators in the RAT process for that, because of what happens is that pretty soon after some time, if there's somebody who's like very vocal and convinced that they've got the answer and they're wrong, and that happens a couple of times, the team will start wanting to just listen to them and have to come up with a better process. Yeah, and then we kind of take the stakes up a little bit because we ask them to put it on the whiteboard. Did you get a chance to do that, Scott? Did you? Yeah, why don't we do that? Go ahead. Or Tam, you've got it? Okay, so go ahead and write your team score on here, which would be 25, right? And then so we would say, all right, so let's see how the teams did. And so everyone would raise up their whiteboard and we see that, okay, great. So these teams did a nice job. They got all their answers correctly. These teams struggled with a couple things. Okay, what items did you all struggle with? Or what were some of the concepts that were challenging or things like that. And then you have a discussion in the room if needed. I have to say, I tend to, partly because I'm very close to the content, I really like to make sure that everybody knows the content well. And if there is some teams that weren't getting it, and they don't know it because they're like, I don't know, it just wasn't clear in the reading. That's not good enough. I would want the other teams to be like, no, this is why we understand it, and to help teach each other in the room. But you have to be careful because that can start to take a lot of time. And so there's a little bit of a balance there. So one of the things we ask you all to always do is do the RATs yourself and make sure that you understand them. And if there's areas that you're like, oh, I would have thought it was this, then that's likely to be something that a student is going to come up with as well. And it's worth talking in your team ahead of time so that you have a nice, clear understanding of why the correct answer is in there. We put distractors in there that are reasonable sometimes. So we're looking for the best answer. There can be other ones that might be correct as well, but they're not the best answer. And there's a reason for that. Yes, so you'll have that the whole week beforehand. Yep. And I would suggest that your process be, look at the learning objectives for the session. And this is in your facilitator guide that you'll get every week. And then it'll have all the pre-work. So just frame the session for yourself and then do the pre-work. Read all the readings, which should take, we say this to the students, it will take up to an hour. Okay, so you need to plan for that. Then you take the rats and you're saying, what did I miss, or how, figure out what your questions are, and then read through the rest of the facilitator guide. So that way, I think you're being introduced to the content in the way that the students would. And if the things that are confusing for you, then that's what we spend time talking about as faculty in our brief before we go into the session. You always can ask questions ahead of time too. We're happy to have, like, this one doesn't make sense, or there's 5 of the same answers for this question. There must be a typo, things like, we're happy to hear any of that ahead of time. We do vet it all, but yeah, Sarah. So, and there's always 10, and for purposes today, we just had 5, but there's always 10, and so it'll be up to 50. The other thing that we sometimes will ask the teams to do right off the bat is to indicate on their whiteboard, oh, question number 3 was the one that there was more discussion around. And so that way, you can get a sense of, okay, seems like there was a lot of, that was the ones that people had a little bit more questions about. We do allow the students to submit, or the teams to submit challenges to questions. So if a team gets an answer, a question incorrect, then they could choose to challenge that and say, we think from the pre-work that this other answer is the best answer, or something was unclear and it would have been better if it was worded like this. If we accept that challenge, then all the teams across the course get the credit for it, and we change it. I think in more traditional TBL, it's only the teams that challenge it, who do the extra work to challenge it, get the credit, but that's just like too difficult for our process. So that's not how we do it. Hopefully all of our items have been vetted enough by now, but there's still sometimes when we make edits and we think it's all clear, and then clearly it's not after 700 students take it. So yeah, so that's the RAT process. And I was just looking at my little check sheet here, and we pretty much went through everything. There's a couple of questions that are prompts down here that you could use if you'd like. If teams didn't struggle with any questions, alternative questions to consider include: what questions does your teams have now about the pre-work content? What surprised you about the pre-work content? What did you learn from your peers about the pre-work content? And that's just a way of, again, trying to promote the inter-team learning, and it not just being a task to get this done, but a learning exercise to actually really go deeper into what the pre-work is about. Okay. All right. And then and you could also even ask them about their team decision-making process. This is the last pieces there. How did your team decide on the answer? Was there disagreement? How did you handle that, as you were getting to before? Okay, and then you'd collect everything up. And so I'll go ahead and collect your RAT stuff, all your materials. And so to certain that you'll keep, and you can, and one of the things that's just kind of, this is why it helps to have 2 people as facilitators, not just for the interprofessional modeling, but also, someone can walk around and pick things up while someone else is sort of getting things moving to the next stage. And after the RAT process, the assumption is that all the rooms are ready to now apply what they have learned from the pre-work, and we've kind of confirmed that everybody is on the same page with it, and you move into the application exercises. And so those application exercises are not things that we're going to necessarily model for you today, but they are activities that the teams will do that will involve further report outs, and we'll either use the whiteboard, or we're just working on getting some cards that say A, B, C, D, E on them. And so if there's like a multiple choice question for the teams to answer, then they'll select that, and we'll use the cards to demonstrate that. Sometimes for application exercises, we have things that are called gallery walks, where the teams have to create on a big Post-it note and their answer to a question or a problem, or proposing something, and then we post them in the rooms, and the teams spend time walking around and maybe voting on the one they think is best, or So there's different ways of doing the application exercises in terms of the team report out, but the idea is that there's work that the team's going to be doing to apply the content, and then there's the sharing across teams, and that's another level of learning from each other. 4 to 5. Yep. Correct. Yep. And so the teams stay in the same room, the faculty stay in the same room. Yep. Correct. Correct. And so it kind of makes a difference as to how they sit. And we, you know, what we try to do is, like you came in, you saw that we were putting you here purposefully. Every room's a little bit different. This is kind of a fun one because we've got these 4 sections, but most rooms do not have that. So some of the job as a faculty member is to sort of take stock of the room. And if you see that maybe there's a team that's not functioning as well because of their positioning, it's not being as inclusive of all their members, or just it's too loud, and they, you know, then it's our job to say, let's move your team. I need to make sure that I can hear each of you all separately or see your report outs, and I want it to be organized a bit differently. So. We're pretty much using most of the large group rooms at any one time on that Wednesday from 3 to 5. Yeah. So we use 60s, 80s. We do use some of the 200s as well. So those have, you know, each of them have different dynamics. We don't use the Ed 1 lecture halls because there's such stadium seating. That's just difficult. But we use the other ones. And the teams stay in the same room, as I was saying, unless there's some craziness, but we're good on that. Yeah, we've been good on that for a while. Okay, one other thing before we move past the rat is I forgot to mention that in my faculty guide, where I had all the, you know, the stuff that I was handing out to you, I also have the answers highlighted. So you've got that as a reminder. You would have looked at it ahead of time, but we just make sure that's always in there for you, readily available, both the TRAT and the IRAT versions of the rat. Okay. Yeah. So great question. We transitioned this past year to posting it all to a Canvas course for faculty. So that's where the faculty guide is. So we post that the week before, and you can just go in and get it. So you don't have to pick up paper copies. It's all electronic. But we did that instead of doing it via email because we figured out we could actually provide you with even more resources, and there's like a discussion board, so if there's questions ahead of time and things like that, that works out pretty nicely. Great question. Right. Yep. So you all are going to have access to 2 courses. One is going to be your faculty resources courses, and that's where we push information to you that's just to you. You'll also be put, like with everybody else, all the other faculty, into the student course. So you can see what they're doing. You could go in and look at your team's products. You could do analytics if you wanted to, but we don't have expectations of going in there. We do use a few discussion boards for the students now, but we are not at the point where we are, you know, for example, some schools and programs have standards for online courses where if there's a discussion board, then the expectation is for students to post something and respond to 2 other posts. And so we don't do any of that. So it's, you know, for the most part, a repository of all of our information. And less of a interactive piece. However, there are some times when the teams submit products that we use rubrics to rate. And so we do have you as facilitators rate your team's products. We haven't gotten so sophisticated that we like actually have you rate other people's products instead of your own, so you're not being kind on them. But because we want you to know what their progression of knowledge is. But we have a couple times during the semester where we ask faculty to review the team products using rubrics. and you would share that task with your co-facilitator and figure out how you want to do it. Typically what we suggest is to have both people try to do it independently, and then you can kind of be your inner rate of reliability amongst each other. But in the very beginning, when we were just starting this process, and faculty were like, what? I have to rate our students? I thought I was just going to be teaching them. They would divide and conquer amongst, but now we're really trying to get people to be more familiar with the content and do that rating. Okay. That, I think, is the application exercise RAT part that I wanted to mention. I think the next piece is just talking a little bit more about some of the expectations. You have in front of you the faculty manual. I just want to highlight a couple things. I kind of already talked through some of the preparation, that we want you to read the pre-work and the faculty guides and do the RATs that are part of it. We do want you to come to both the brief and the debrief. We do know that there may be other obligations that might keep you away from that. And so just please communicate to us if some of that is not possible. But the reason that we have this kind of heavy faculty development piece around it is that we do want to make sure that our faculty are learning not just the techniques but the content well, and that we're delivering similar product really to all the different rooms. And so we have the brief time for the different, we call them crews, color crews. The different faculty crews meet together and say, okay, I read through all this stuff. I had 3 questions. What do you guys think about this? And so you guys will have a chance to check in with each other and get some tips during the brief from the content experts of the sessions. And then the debrief, we have a pretty structured process that just for a half hour, we drop off the materials, we quickly get back into our crews, and we answer a couple questions, what went well for the session today and what needs to be improved. And then we post that to our faculty Canvas course so we can capture all of that. And then we spend a little bit of time debriefing some of the team development pieces. So if faculty are saying, in my room, there's just one team that is just having trouble with, for some reason, this is what I'm going to try today, and then they can get back after the session and talk with each other about that. Because again, these 3 different roles are, it's a lot, and it's good to keep on working on it and having a group of faculty that you can learn with. So that's why we have that structure. And a couple things about ideal characteristics. We do want you to be comfortable enough with TBL so that you can enjoy it and be enthusiastic about your time in the room with the students. We also want you to be able to share about your passion for interprofessional collaborative education or practice and share part of why it's important in your view. So we want you to be able to talk about how this impacts you and why this is important and things like that. We don't want you to spend too much time lecturing students about other things or about the content if there's an area that you really like that we're covering, because we really want them to be learning and teaching each other for the most part, but we want you to be reinforcing it and helping to model its importance. Yeah, so you can read the rest of those pieces. The other stuff in here I'd like you to take a look at on your own time. I guess page 2 for the most part just talks in general about TBL components. We have a section here about sharing facilitator duties. It's a structure in here that we've had in the past called the presenting and monitoring facilitator. That's just for your, it's an option. People might have different ways that you would like to work together. And so when you have your co-facilitator assigned and you're meeting with them, it's always good to say, well, what's the plan? How do we want to do this? Do you want to handle this? I'll handle that. How do we want to work together? So we're okay with, what you all want to do, and that can vary. Yeah. Then, yeah, so how we handle that is, one is that we're grateful when you tell us that as part of when you accepted the calendars, and then we know that in advance and we plan to have a substitute in the room. So we have a pool of substitutes that we use. For the most part, those are well-experienced people, so they can jump into a room and know the content and can go from there. I often function as a sub and that helps me get a sense of how the rooms are doing too. So that works out pretty well. There's also some general, or not general, but sort of faculty specific information in here that starts on page 4. So you'll have access to the syllabus, which gives the students all this information, but there's a couple things that might come up for you. For example, like what do you do when the students have challenges or they're like, we don't like rat number 4. How do you handle that? And so there's some guidance there. How do you handle absences or students that are late? So we have some very precise structures around that as well, because we, again, need to be equitable. And if we're starting the rats right off the bat, you do about 5-minute intro and sort of settling, but then you go right into the rats. So if students are late, they have 2 choices. They could either come in and have less time and finish it up, or they can step out of the entire rat process and come back in after the TRAT is complete, and then take it in a makeup structure. So, but we do that just to be fair. And if there's students that have to leave early, then they have to actually complete some of the work that they missed. So we think this is important content. We spent a lot of work to try to bring it to the students, and we want to make sure that they get it. So, yep. Okay. And I talked a little bit about accommodations. We have, let's see, curricular integrations, the course. There's representatives from each of the different programs. Scott is the representative from nursing. I'm the representative from medicine. So we're aware of what the content is. We make sure that it integrates appropriately with the rest of the school curriculum. And we have student reps who also help. And so if there's problems or issues that are coming up for different programs, we always have the faculty representatives and the student representatives to be able to go to. So as a faculty member, we want you to connect with the learners and to find this to be, a genuine and engaging process for you. But we also don't want to burden you with issues that need to be handled more centrally. So we pretty much try to have you help move off of your plate the issues that you don't need to worry about as much. Does that make sense? All right, so that's the faculty manual. There's also some other additional TBL guides. So there's an article called 12 Tips that we will share with you. And then this here is a observation and feedback form that was created several years ago. And essentially what it does is it just lists on the left side some of the TBL facilitator skills that we would like you to be growing and developing in. And so this structure, this form was used in a structure that's called I Teach, which is where faculty would say, well, I would like to have someone come and observe me in being a TBL facilitator. And so this would be used to sort of jot down what they were doing and what they could work on improving and such. We don't really have the capacity right now to have each of you all observed in that way, but we could. So if you're interested in that, please let me know. And then let me know like when. You're probably not the first session. So, but as we get towards the end of the semester, if you would like that observation and some feedback, which is completely based on what you would ask for, then we're happy to do that. But I just think it's a nice little reminder about what are the things that I should be doing in the session through TBL. So that's some of the other TBL resources. And then coaching. So this is the next piece. So we talked a bit about being an IP promoter, sharing your experiences and interests, as well as, I didn't say this so much explicitly, but we do want you to pay attention to how the professions are interacting together in the room. And so if there are moments when maybe there isn't as much respect or there's not inclusion of certain professions in some of the discussion, that you're being attuned to that and can draw it out and say, okay, so it looks like we've heard 3 different comments from medicine here. Let's hear from some other professions. What about nursing and pharmacy and dentistry? Like, what do you, or let's make sure to hear from each of the professions in our next piece. And so you can try to model bringing that out. Okay, so faculty, IP promoter, and then coaching. So there's really two big chunks that we do with coaching. One is that we try to encourage the teams to set goals around how they're going to work together as a team. And so as faculty, we want to provide them some supportive guidance on that. The first session in the fall semester is going to be all about the feedback. They rated themselves, they rated each other. So we'll have a lot of stuff for you all to look at about how the team is performing, and they'll be asked to set action plans for the semester. So I'm not going to talk any more about that right now, but that is definitely part of your role, is to encourage your teams to develop and to have better behaviors and skills. Yep. Feedback. Yep. From last semester. Yep. and we'll want you to sort of provide supportive guidance. One of the things that we'll provide you with that information in advance too. And one of the things I noticed is that sometimes some teams will go right to the issue. They'll be like, oh my gosh, look, somebody on our team said that they're never included, and that we're missing hearing from all perspectives. We got to change that. Like, they might be all over that. And other teams would be like, oh, this looks pretty good. Let's move on. And so as a faculty member, you might need to say, okay, when I was reviewing your things, I saw some discrepancy here. What did your team think about that? And so putting it back on them to think it through and come up with, oh, I didn't really pay attention to that, or, well, I kind of, so part of the job is to be aware enough of the teams to know which ones you need to move along and help. And some teams would be like, we need some help. We can't figure this out. We're a mess. And then you could provide some more directive coaching because they're asking for it. So we get the full spectrum. Sometimes we also have to address challenging behaviors, and that's what I want to spend just a couple more minutes on together as a coaching technique. And I'll give you some frames for this. This is new for us, and I think it's pretty useful, is that we are thinking about the different options that we have when we notice either individuals or teams having challenges. And there's really three options as a facilitator. One, you could ignore it. So maybe something's not that significant, or it's the first time it's happening. You're not really sure, like it's something that you could tell there's somebody else in the team that's noticing, and they're probably going to be corrective about it. So you could actually, as a facilitator, you don't need to step in. You can ignore it. The other is to confront, and that would be either confronting the team, saying, okay, I'm noticing every time that your team is struggling to get finished when the rest of the teams in the room are done. How are you guys going to handle that? And so you might actually confront a team or confront an individual student who might be disruptive in their behavior. And then finally, process, which I'm mixing confront and process a little bit, but processing is to like really work with the team and say, okay, let's set a goal around this, and let's see how things go over the next couple of sessions, and let's really intentionally work on this, and I'm here to help you, and how can I assist? So those are really the three options when something comes up. And this picture, I think, is trying to show that with some of the things with confronting, that if something is happening that could really significantly impact the team function or an individual, so it's at high impact, both in that it might have high harm, or your ability to kind of stop things right away is going to have high impact, then that fits in the confront. And the low impact we talked about, like, oh, it's really not too big of a deal, or it's just a one-off or something like that, then that's something you can ignore. But most of them are going to be in the processing, trying to work through. Okay, so this is what we have also thought about in getting around to that ignore, confront, or process decision, is just to be transparent with ourselves as faculty about what's going on, because a lot of times we can jump right to the solution, and it's helpful for us to identify what our what we're bringing to the issue as well. So this is a suggested structure that we've been using, is the thinking about, okay, so why is this situation difficult? What is it about the team, the environment, the task? What, you know, like, why really is this conflict or challenge happening? And then the second part is the self-reflecting. How is this making you feel as a facilitator? Are you getting anxious? Are you irritated at the students? Are you frustrated with them? Are you like afraid of having to bring up this issue? You know, and just taking a pause and thinking about where you're at with it. And then that helps you then, when you've kind of objectified that a little bit, it makes it a little bit easier to decide what's the response that it should be. And the good news is that you're doing this together, right? You're going to be together with another faculty. So if there are issues, then you can kind of talk through these together. But it could be that you feel like you don't want to do it at all, but ignoring is not the right answer here. So just taking a pause and sort of recognizing your piece is good. And then thinking through together, okay, how are we going to actually do this? Am I going to confront it right in the middle of the session? Call the student out, you know, or is this going to be emailing them afterwards, or, you know, so thinking through those basics. Now, just in case you're worried that there's tons of challenges all the time and you have to like deal with students, that's not the case. But we do have occurrences of challenges, and so that's why we want to make sure that we're giving you some resources around how to do this, and that we would actively be working on it together as a full faculty cohort. We've, like this past year, we had student teams saying, or faculty saying, okay, so here's the issue for our room, and what do people have some other ideas or suggestions? And so we processed it as a faculty too. Okay, so now let's do a couple of examples of this. So I have a couple scenarios that we want to talk through that are pretty basic. And in the past, I've done this as a fishbowl. I don't think I'll necessarily have you move unless you guys feel like you need to move, since we've been sitting for a while. Okay. All right. A fishbowl, just so you know, is where you have a couple of people in the center thinking about an issue and brainstorming quickly about what's going on. And then you have people around the outside listening for themes or interesting concepts or things like that. So you're engaging everybody in the process. But there's some that are sort of tasks with answering the question, and others that are tasked with interpreting their responses. You gotta go? Yeah, got it. No worries. Just so you know, Scott's been he's been a sub over the years and done other things like that. So, but he's very kindly coming to this. So make sure to get the full picture of the new frames, right? So, are we ready? All right. So now we can do 2 and 2. So we'll start over here. And so I'm going to ask you the question. And so you just brainstorm your initial ideas and thoughts. And then if the two of you could think about, are there some themes or other interpretations you can make of what they came up with, okay? All right, great. So here's the scenario. The teams in your room are having just terrific discussions during their application exercises, but you're starting to look at your watch because like you got to move on to the next one, but they're like so engaged with this thing. What do you do? How do you cut them off? What do you do? Any thoughts or reflections on what you heard? Either is good. Yeah, either is good at this point. So yeah, it's harder with it only being a dyad. So yeah. Good. And I'll just add that we have, for each of the application exercises, we do clearly indicate how much time they should take. And one of the roles that the teams have is for a timekeeper. So something you can know as a facilitator is say, timekeepers, how we doing? Or, you know, sort of, and I've definitely gone up to teams where I'm like, who's the timekeeper here? Me. And then they're like, oh, maybe I should actually keep time. You know, it's funny. And others like, we're on it. We got 4 more minutes left. Thank you. You know, so so it really varies. Great. Okay, so let's go to the next one. So here's a scenario for you all. And so again, listen either for things to add or if there's any interpretations or summaries. And I'd like to hear a little bit about, just like they did for the first one, what ends up being your response. What are you thinking? Is it ignore, confront, or process? Okay. So you notice that a student is reluctant to participate and doesn't seem to be engaged on the team. What do you do? To add or to summarize? Oh, we definitely have a lot of knowledgeable, assertive people in in our professions too. So, yeah, I think one of the things that's different about team-based learning is that really our first pass is to try to get the team to handle it. And sometimes that means that they need to fail a little bit, either in their rats or in getting their act together or in their getting frustrated with each other. And then sort of having a okay zone of that, knowing, observing it, but asking questions, saying, it seems just as I'm observing your team, I'm noticing that not everybody is getting an opportunity to participate. So that's something your team might need to think about in your process. Just sort of planting a little seed and then moving on. But there are some very, some of the skills that you would use in a typical small group learning environment do play in here. Like I've definitely found that I will walk around and the laptop's closed. And sometimes I'll have to say, let's make sure you're focusing on today's work. Or, so sometimes you have to do that kind of thing for students. We definitely had I remember we had a student at one point where the team was really concerned because the student was like always standing up against the wall instead of sitting with the group. And it turns out that they actually had a medical issue. And so it was uncomfortable for them to be sitting. And so, they needed to process that a little bit, and the student needed to get to a point where they were comfortable enough sharing that with the team. And then that resolved it. But for a while, people were like, they're not even involved and they don't even listen. They're standing up against the wall instead of being a part of our team. And they needed to be empathetic and open and student-centered with each other. So there's opportunities to teach that. And it's so tempting often as the faculty that you've identified it, you want to fix it. But they're together for 16 weeks. And if they can learn the skills of helping to fix each other's teamwork, that's what we want, really. So yeah, so we teach it pretty explicitly now, and we have processes like using briefs and debriefs. The role document includes not just a timekeeper, but a participation monitor, and I feel like that the students aren't quite still really, like we haven't done a great job with that part yet, but we have structures in place to set what the expectations are. And so that's the other thing, is to say, how are you guys doing on your ground rules? And so we have mechanisms so that we're not expecting them to just have to fall into it. Carry over to the fall. Yep. Okay, let's just do another couple ones because I think they're important and might come up. So over here, another scenario, some teams in your room are getting the content quickly and taking it seriously, but other teams are not. How do you handle that? Things to add or reflect? I would say that more often the processing happens within a team than within the whole room. But sometimes faculty will say, hey, boy, it just feels like we're just off today. Everybody's sort of like crazy, running around, we've got an important next application exercise. Let's just try to pull it together. Like, so that might be a room confrontation with a little bit of, without actually taking the time to process it, but you kind of sort of say what you're observing. And I think that is totally fine. But there's also differences. I think in the faculty, sometimes some faculty really want to draw out that competition, and others want everyone to succeed and feel good. And so, like, it kind of depends on the style of the faculty to a certain degree as to how some of this plays out. It'd be nice to have a little bit more similarity, but I would admit that I think like there's definitely some. I know some faculty members, and I'm always amazed at how they kind of pull their teams together. They kind of jab them a little bit in the competition. Hey, team, got to pull it up, team 25, or something. That they might make that kind of a comment. But then we've also had students that then have said, this has created an unwelcoming environment. There's a balance between all of that. But to sort of summarize, to answer your question, I think for the most part, we end up addressing it at the team level, but it's completely open to do it in the room. And there are times when that's important too. Yeah, and so there's not a lot of time for that. So that's why sort of, you'll have to decide how important is it, or is it really something that we can ignore? We know it's spring break next week, so they're just all like, blah, and you let it go. So yeah, so you have to be cautious. There is not that much time. Now, because we have access to Canvas, you all could certainly go and message a team. It's not doing the face-to-face communication, but you could always say, hey, really, I didn't get a chance to, because it was too busy. I want to say really great job on that first application exercise gallery walk. Like, it was awesome. I like this, this, and this, and this. Just let you know, I also noticed that your submission didn't reflect everything that you did. And so in the future, I want to make sure, want you all as a team to make sure that you're putting into your documentation all the good thinking that you're doing. I don't know, something like that. So it would be okay to communicate with them asynchronously if need be. All right, last one. So you all hear a student be negative about the value of the content or the course. How do you handle that? How do you approach that? Walking in and there's someone just talking on the side about how this is a waste of time. It's never going to be applicable to what they're doing. They got to study for their exam. Right. We're going to actually have an announcement that we'll send out to the students coming back in the fall and say, we saw that many of you said that you don't like being quizzed on having to do reading ahead of time. And we, appreciate that this may be a difference from what you are doing in your other courses. However, it's part of what we're going to continue to do. And we know that it works, and we're proud of the knowledge that you've gained so far, but something. So, but yeah, like there are some things that aren't going to change, and sometimes just saying that respectfully is can be very helpful. So, yeah, things to add. Yeah, yeah. I was just reflecting as you were talking about that part of what the core of this is to be learning about other and respecting and growing from that learning. And so sometimes we need to learn from the uncomfortable parts. And like, it could be that the AA is grumbling because they're like, none of these cases actually apply to me. And I know there's only 12 of us here, but it's really hard to come every week when nothing actually applies to me. And then you could say, well, let's think about that. Or we could ask the faculty, hey, every week, could you share a little bit more about how this applies in the AA world? We could actually problem solve around that if we figure out what is the core of the frustration or the issue, and sort of balancing that and can meet the needs. I agree, though, that a lot of people, if they're already going to be grumpy about it, it's really hard to move out of that space, but it sometimes can happen. Yep. Yep. We had a faculty last year that had to talk with an individual student and say, look, I know you don't like this. I'm not liking it very much now because you're not very much fun, but I need you to not be grumpy in the class because it's making the whole room not good. Can you do that for me, please? And that's like pretty direct confrontation and say, look, you don't like it, I like it, we disagree. Can I have you not, publicly continue to talk about this though, because it's not helping anybody else. you're not convincing anybody else, and we're not convincing you, but can we do this civilly? So, like, I hope we don't have that ongoing issue, but yeah, so. Okay, so I hope from this that you have a sense of this, like, confront, ignore process as a way of thinking about it, and also checking in how your feelings are and how would you implement it. You know, really gets down to being student-centered, but also team-centered, and trying to promote the whole process. So there's a little bit more of guiding the team on addressing issues rather than individually taking it on. A little bit more patience, and ignoring perhaps over time. But also, you know, if there's things that are really deterring the group from functioning well, being okay with saying, I can't let that go because we're going to come back next week. It's going to be the same. So yeah, great. Okay. So now we're just at the sort of the last bit here. I think, I don't even know if I have any more. Yeah, it's just logistics and questions. So let's see. If you haven't, if there's any change already, make sure to let Reese know about any changes in your availability. They have the smart sheet. Okay, great. We have the IPED fall orientation in a couple of weeks, September 5th. That will be when you'd meet your co-facilitator. There will be material ahead of time to look at as well around that, just to kind of get yourself oriented. That will also be recorded. Is that correct? Okay. So again, we try to do that so that if something comes up, you're not going to be sunk. You can still look at it on triple speed or whatever it is to try to catch up with it. All right. Right. Let me finish with the IPED stuff first, though. So for the fall IPED course, we will give you access to the faculty resources as well as the course. Not ready quite yet, but that'll come. Everybody, I don't know whether, Sarah, do you have Canvas? You probably don't. And I think I remember last year that another psychology intern, we had it's a while to get their access to Canvas for some reason. So the two of you all might want to just make sure we get that moving. I think in a different category as a trainee. Yeah. Maybe it's all good, but someone last time had trouble. I don't know if it was them or the structure. Yep. Okay, great. And then just so you know, we still send out an email prompting people about the next week sorts, right? There's something. Oh yeah, we give you the schedule, like, you know, who, if there's a sub, who it's going to be and that kind of thing. So we send an email out on Monday of the week with information. If any of you are coming from off campus and you need parking, you'll need to connect with Reese about that. We don't just keep on putting the parking code out there because it can kind of get distributed. So please don't hesitate to reach out to Reese if you need parking codes. And then the other piece has to do with IPE Day and what that means. So I know this is confusing, but IPE Day that we're having in a couple weeks now, that's for the new students coming in. So the fall semester is for the second year students. The new students coming in are having this one IPE Day experience, and then they'll come and start IPED in the spring. And so if you're signed up for that as well, terrific. You'll get to see what it's like, you know, from the get-go, and the students that don't know how to do anything with TBL, and we'll be instructing them on that. That's what that's about, and then we have a training for that as well. So any questions about all this? It's hard when you've got two cohorts at once to make it clear. So. So that's the training for the IPE day. The IPE day is on the 29th. Yep. Yep, that would be great. Two to three. Yep. 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 4:50. $5:30. Yeah. So the whole thing is 2 to 5:30. Yep. 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 So to be very transparent, this is a big undertaking that you're joining because you've got an hour pre-work to do plus reading the faculty guide, and then on Wednesdays it's 2 to 5:30. So this is pretty solid, and we'd love to keep on, refining your commitment, but it seems to be what it takes. There. Great question. Yeah. So for the course, and I don't think we actually shared this, and there may have been something about TBL in general, but so the students get, we have sort of a spectrum of needing to meet expectations across several things. So they have to achieve a certain level of percent correct on their IRATs, a cumulative IRAT score. They also, they have to be a part of teams that achieve a certain level of cumulative score on their TRAT. No teams have ever not gotten there. So that's sort of a gimme. But anyway, they have to actively attend the sessions. And if they miss a session, they have to make up the content. They also have to be a collaborative participant in any team products. And this year, we're at the point where we're rating the team products, and we are requiring teams to redo team products if they don't achieve our level of expectation. But that doesn't ever end up diminishing an individual student's grade at this point. It could be in the future as we continue to refine those team products that if the team is not doing as well, then the student's grade is less because of that. And then they have to complete some peer feedback and team assessments on their team about how their team's doing. And so that is all in the context of the fact that the programs handle the participation in this course slightly differently. Most of them are pass-fail. And so you have to complete all these things and get to a level in order to pass. So there's very, very few students that end up failing, but we do have students that have incomplete grades, and then they have to do remediation and things like that. So we're not at a true point system, even though the RATs have points. Yeah. Other questions? Good. Well, we're just at 5, so thank you for your time. I appreciate it, and if you have other questions that come up, don't hesitate to email in advance, and we'll see you again soon. Thank you.